Hi everyone, it's Yesenia here from Fullness of Life Counseling. I'm a licensed clinical social worker in private practice in Bradenton, Florida. I work with teens and adults on a variety of issues from anxiety, depression, relationship issues, behavior, parenting, a lot of topics that are affecting teens, adults, and families. So it's been a while since I did a live video. I really don't like doing them, I'll confess that. But I think it's important to share information, especially via video, because I feel like those are a lot more popular than, say, reading an article, which I do share a lot of on my page. I share a lot of articles. But I really wanted to come on here and talk about a topic that I feel is very important to discuss. So this is actually going to be a 3 to 4 part video series. Today I'm going to talk about anxiety. And I want to talk especially about the symptoms, recognizing what the symptoms of regular anxiety are versus disordered anxiety. So bear with me as I deal with some of these video issues. But what I really want to talk about anxiety is because this is something that I'm seeing is very common in our society, in our culture right now. It's really struggling with anxiety, and it's just becoming something that we do need to be more educated about and help each other with, help our children if our children are suffering with it. So when we talk about normal anxiety, it's an emotion that we feel at times. People describe anxiety as, being worried or nervous, scared even of something. So it's very common to feel anxious, like before we're going to do something out of the ordinary, like let's say give a speech, take a test, go to an interview, something that has a great bearing on our life can be a cause for a feeling of anxiety. But once the situation passes, the anxiety passes as well. But when we talk about disordered anxiety, it's a constant state of being in a person that affects their functioning. So when we talk about functioning, that means working, going to school, playing, and anything we just do to live our life. So when anxiety starts to get in the way of those things, that's when there can be a problem of a generalized anxiety disorder or another type of anxiety disorder. So today I just want to talk about the symptoms. I don't want to take too long on these videos because I also want to do one in Spanish after this. But so what are the symptoms? So a person that is struggling with disordered anxiety is, on the emotional level, always has feelings of apprehension or dread. Sometimes even basic tasks like working or going to school can be overwhelming for the person. So there's a lot of apprehension the night before, a lot of thinking about what's it going to be like, what to expect or what not to expect, things like that. So there's just an overall dread of the day or what's going to happen. The other emotional symptom is feeling tense and jumpy. Just overall, always feeling restless, tense, and easily startled can be part of that emotional reaction. I already talked about restlessness, being irritable. A lot of people don't realize that irritability can sometimes be a symptom of anxiety. Some people, their irritability actually goes into anger. But beneath that anger, there's a lot of anxiety, a lot of fear of, again, a fear of what is to come, or a fear of the unknown, or fear of many things. So, in general, we can be afraid of many things, but, it can manifest as irritability and anger. Another emotional symptom is anticipating the worst and being watchful for signs of danger. So always thinking of worst case scenario, the what if, what if this happens, and just overthinking it. Again, it's normal to think about these things because anxiety actually has a function in our life. Anxiety has a job, and that is to prepare us and keep us away from danger. It's because of anxiety that we know to stay away from dangerous things or places, people that are dangerous. But when it's constant worry, constant negative thinking about the worst and being worried about danger, then it's a disordered anxiety. And I want to talk about the physical symptoms. And for me, I talk to my clients about anxiety on the 3 levels: spiritual, physical, and emotional. So there is some physical symptoms that are that we can pay attention to our body that tells us that we may be struggling with anxiety. So one is pounding or racing heart and shortness of breath. So oftentimes people will feel like they don't get enough air in. They're breathing, but they don't feel like their lungs are getting filled up. So oftentimes people will go to the doctor with the physical symptoms I'm going to talk about, and the doctor will do labs and will do testing and then rule out that there's anything actual physical going on. And usually a doctor will then refer the client to, or the patient to, a therapist to deal with the emotional and mental effects of anxiety. Upset stomach. So again, a lot of times we've maybe at some point have felt these things before doing something that causes us anxiety. So the pounding, racing heart, shortness of breath, upset stomach. But this is, these type of symptoms, when it's disordered anxiety, happens even when things aren't happening. Just like wake up and you start feeling this way, or you're doing ordinary things like, brushing your teeth, washing the dishes, and you start to feel these symptoms and you're like, why do I feel this way? It can be a sign of anxiety. Sweating, tremors, and twitches, headaches, fatigue, and insomnia. Sleep is very highly related to anxiety, both causing anxiety, but also as a symptom of anxiety. So it's kind of like a cycle. Sleep is very important. I'm going to talk about that in the treatment video, where I talk about natural ways to deal with anxiety. Sleep is the number one thing that I bring up to my clients right away when we identify that anxiety is the problem. I talk about sleep. I ask them about their sleep, and we begin to work on them getting quality sleep, because that is directly related to the anxiety. So fatigue, obviously, if you're not getting good sleep, you're going to feel fatigued. Headaches, because you can't think clearly, and stress headaches as well can come from anxiety. And upset stomach, which we kind of talked about, frequent urination and or diarrhea can also be symptoms of anxiety. So I've talked about some emotional and physical symptoms of anxiety. And again, distinguishing that normal anxiety is every now and again, and with the situational anxiety. But when we talk about disordered anxiety, this is a person dealing with this on a day-to-day basis for more than 2 weeks. And so this isn't normal, and it's not okay. And there is help. So I encourage you to tune into my Facebook business page. You can like it and then follow it. Make sure you get notified. And in the next few days, I will do a video on what causes anxiety, what are the causes, and what kind of person is more predisposed to feeling anxiety. And then in my third video, I'll talk about what are the treatment options, both medical and natural as well. And then if there's any questions for me about anxiety, I'd like for you to inbox me privately. It is private. If you inbox me, you can email me, Yesenia@fullnessoflifecounseling.com. If you have any questions, I'd be happy to answer questions, or I'll gather a list of frequently asked questions on anxiety and do a fourth video if that's needed. So again, I just wanted to come in here, share some information, start to talk more about anxiety and other mental health conditions, because I think that there's people that are hurting out there. They're suffering with this, and they're not getting the help they need because they're afraid, or they just don't know that there's help. They're afraid of what people might think of them. There's a lot of stigma still in our community about mental health issues. And so this is why I'm doing this video. So thank you so much for joining me and for tuning in. Share it with people you know might be interested. And I'll see you in the next video. Thank you.